Welcome to Heroic Herstories, Women in Medicine with the Katies. This podcast is to document the stories of women trailblazers in medicine in the state of Iowa. We will highlight seasoned women in medicine to create a brief oral history of their works and lives. We want to learn from their experiences, share their vast knowledge, and gain insight into the challenges they have faced. Our goal is to lift up those who have gone ahead of us and thank them for their incredible service and dedication in our wonderful field.
Hey, Katie.
Hi, Katie.
Today, we are incredibly excited to welcome Dr. Amal Shibli-Rahhal to our podcast this morning. Yay! Dr. Shibli-Rahhal, how would you like us to address you today during the podcast?
Just Amal.
Just Amal. Okay. Well, Amal attended the American University of Beirut in Lebanon for both her undergraduate degree in 1996, and she graduated with distinction, and then her MD degree in 2004, and was inducted into the Alpha Omega Alpha Honor Society. She completed 1-year internship in Beirut and then matched at the University of Iowa for residency in internal medicine. She then went on to complete fellowship training in endocrinology at the University of Iowa. In her time on the faculty at the University of Iowa, she has been incredibly involved in leadership and education. She earned both her master's in clinical investigations and master's in medical education, and has been involved in teaching many different levels of learners, fellows, faculty, internal medicine residents, and medical students, and also extremely involved in educational leadership. She was the associate program director and then program director for the Endocrinology Fellowship. She was the Associate Chief of Staff at the VA Medical Center prior to moving to the medical school for a role as the Assistant Dean for Student Affairs and Curriculum at the medical school. Since then, she has become the Associate Dean for Student Affairs and Curriculum and is the lead for the entire medical school for the LCME faculty accreditation, which for any of our listeners out there, this is no joke. I have like a 0.2% role in this, and it's unbelievable, all the coordination and work that goes into that. Throughout this time, she also performs research, particularly in the area of osteoporosis, has earned multiple grants, and has been nominated and won all of the teaching awards, especially in the medical school, many for the M2 Professor of the Year award. We also love seeing that your patients are also big fans. Your Press Ganey scores were in the top 10% nationally for patient care. We could go on, but we want to hear more from you. So we would really like to welcome Dr. Shibli-Rahhal to our podcast. Thank you, Amal, for coming today. We're so excited.
Thank you for inviting me. This is a great honor.
So we always like to start with some hard-hitting journalism because Katie and I are journalists. That's our / physicians. So we, you came from Lebanon, which we found is a Mediterranean climate with hot, dry summers and rainy, mild winters. But you've been here for, a couple decades of Midwest weather. So our question for you is, if your personality could be described in weather terms, what's the forecast?
Okay. So I'll start by describing my personality, and then that will explain the forecast. I'm passionate about the things I do and that I choose to do. And once I've committed, I stay with it until it's done. And I'm not a flip-flopper. So I'm either your friend or not your friend. I either like you or I don't like you. And I'm not, I'm as transparent, as straightforward as can be. So with that in the background, I'd say I am a hot summer day in Lebanon with clear skies and no chance of storms.
Just relentless heat.
The heat is the passion.
Okay, yeah, right. That's what I'm
Blue
saying.
sky is, no threat, persistence, all out there. You know exactly what to expect from me until the end of the day.
I love this, and I'm also very scared because what if we fall on the hate side, Katie? I'm not sure.
We're not out of the woods.
We're not out of the woods.
I'm talking to you, right?
That's a good point. Good
so
point.
That means I like you.
I do find that. I mean, I feel like I'm an ultimate flip-flopper. Like, I can be so wishy-washy. And I kind of felt like a lot of internal medicine people are kind of like that because it's like, oh, we could choose this, we could choose that. But no, you're like, bam, make a decision.
Yeah.
I love that. I'm jealous of that, frankly. I need to be more decisive sometimes. Okay. All right. Now that we know the forecast and we're hoping we're on the
Mhm,
sunny side. Yes.
mhm.
Okay. This is a topic we don't really bring up very much, but I had to do it because Amal, you've like really impacted me on this because Katie and I are not fashionistas. I'll just put that out there.
Uh-huh.
Um, Clothing and shoes, not really our specialty, but you are always dressed to the nines. I mean, you look so professional, so put together all of the time. And I'm just curious, in this age of athleisure and designer scrubs and frankly pajamas being worn at work, what inspires you to put on real clothes every day with a waistband,
With
like
the
what
waistband
what inspires you to do that?
And heels.
Heels,
and the
beautiful
heels.
heels.
Yeah,
Yes.
the heels have gotten harder since COVID, and just as I get older, um, I just have too many. I cannot not wear them at this point. It's an investment I have to keep using. Um, what inspires me? I don't know. I'm Lebanese.
Okay.
That's the thing. If you go out, the joke is if you go out to throw the trash in the outdoor bin in Lebanon, you have to be dressed with makeup.
Okay.
I
Oh,
think at least that's how I grew up. That's the 11 years version that, I think things are shifting, but
yeah.
uh, yeah, I think it comes from there. It's like I never learned not to do that. And yeah,
I
and
love that.
I like clothes. I like clothes. I like shoes.
There you go.
The only time I've worn scrubs are if I have to be in the OR or in a procedure or if I am on call at night.
Yeah.
Otherwise, you wouldn't see me in scrubs.
And can we also note that scrubs usually don't fit women? Can we just put that out there?
Yeah, I do that. And they're too cold anyway. I'm cold all the
Yes.
time. So
Yes.
there's that factor as well.
Yes.
Mhm.
Okay. That was another hard hitting question. Sorry about that. I had to put that one in there.
Journalism.
Yes.
So let's go back to the very beginning.
Yeah.
We just want to start at the beginning. Where did your idea to go into medicine come from? How did you decide?
The uninspired part of it, okay, is that in Lebanon, being that it is an unstable country, the general thought is if as a child you are smart enough and achieve well enough in school, you are encouraged by your environment. The expectation is that you're going to become an engineer or a doctor because these are specialties that are stable and transportable if you didn't stay in Lebanon. So with that, I grew up with the idea that I'm going to become an engineer or a doctor. I loved my pediatrician too much, so my choice was I want to become like him without ever thinking about it. Like that's what my parents expected, that's what society expected, that's what my teacher told me. So I grew up with that idea. And I went into college with that idea. I went in pre-med into chemistry, and but I loved chemistry so much. I loved organic chemistry so much that at some point I decided that why do I even want to do medicine? It was never my choice. It was something that was just infiltrated into me, kind of like put in me. I never chose it. So anyway, I'm studying organic chemistry in undergrad, and I decided to pursue a PhD in organic chemistry. And actually, we made arrangements for that. My professor worked with me, and I got admitted into McGill in Canada. And of course, my parents were livid, but then accepted. And then my dad basically begged me. He said, "Well, that's fine. Just sign up for the MCAT. Just register it. Don't take it. Just sign up for it. In case you change your mind, you don't want to miss that milestone." And then, so basically, I signed up for the MCAT. I was set on not taking it and on going to McGill for my PhD in organic chemistry. And then there was an Israeli war on Lebanon in 1996, and it was a really hard one. I was in Beirut. My parents were in South Lebanon. South Lebanon was hit very hard. I got stuck in Beirut. We, as college students, we started working with the displaced population from South Lebanon who were staying, in shelters and in schools, and doing some groundwork, bringing food, collecting money, bringing blankets, that kind of stuff. And that work with people is what basically by the end of it, or, as we were doing this, and the MCAT was like 2 weeks later, I started thinking, what am I doing? I mean, this is me working with people. This is what I love to do. I love to be helping, to be there with them. So then I decided, what, I'm going to sit for the MCAT. If I do well and I get accepted into med school, it means that's really my destiny. If I get declined from med school, then it wasn't meant to be. But so I basically changed my mind again, but this time out of choice, out of that experience with the displaced population and helping them and working with people on the ground, that I realized that this is really what I want to do. I don't want to be in a lab doing research my whole life. Yeah. And so I sat for the MCAT and I got into med school, and everything else is past now.
Wow. What a brave and courageous decision too, right? I mean, because,
Well, I have my dad to thank for it, because he insisted that I sign up for the MCAT.
wow, what amazing. That's amazing. Then you stayed at AUB for medical school. And then it seems like, well, then you came to the University of Iowa. But it seems like there's this kind of long-standing, I would say, warm relationship between AUB and the University of Iowa. And I just had two questions about that. Number one, do you know how that started? Maybe it started with you. And I guess number two is just, what drew you here? What made you look at Iowa?
Yeah. So no, it did not start with me. It started way before me. We had a professor back in Lebanon who at the time when I was a medical student was already retired and fairly old, but he would come in as a teaching, to do teaching rounds with us. He was a pediatric endocrinologist and he had trained in Iowa. So if you do the math, he had trained in Iowa way back when, because his whole career was in Lebanon, and he was probably in his late 70s or 80s by the time we were medical students. And then there was another very strong connection that we have to Iowa, and this is one of many, but I don't know if you ladies know Dr. Afifi, Dr. Adel Afifi. He was a pediatric neurologist. He passed away a few years ago. He was a neuroanatomist as well, and he had written a neuroanatomy book. It's called Afifi and Bergman, which we used to study back in at AUB. That was our textbook. And so Dr. Afifi, he is Palestinian Lebanese and then American. And his career has been between AUB and University of Iowa at different stages, depending on, what's going on in terms of wars and politics and what have you. But he was never not at AUB. So even when he came here full time to Iowa, he still went back to teach us that course.
Wow.
To teach medical students every year that course. So he taught us when we were students, but we knew he was faculty at Iowa. So that's how far back the connection goes. And there are many others, but these are the two that I've always been the most aware of and that I've interacted with. In terms of, why did I even decide to look at Iowa? I had a friend who was doing a PhD in public health in Iowa. And she had come here a year or two before it was time for us to apply for residency. And she kept encouraging us to apply to Iowa. My husband, Riyadh, and I were going for couples match. So we applied because of her encouragement. And then, we came here and we just loved it. And actually, it was the first interview we did, and that set the standard, So from there, every other interview we did, we had to compare, is it better than Iowa or worse than Iowa?
I love that. What I mean, for our millions of listeners out there, I mean, the fact that you were couples matching as an international medical grad, I mean, that just tells you how amazing of a person and applicant you were, right? Because, I mean, that's hard. That's a really hard.
Stop inflating my ego.
No, it's true. Oh, that's amazing. I love it. Wonderful history.
And we've heard from other folks that when you come to train for residency in the U.S., that transition from your medical school experience to residency here can be challenging, not necessarily because of the medicine, because you come in well trained, but the culture and adjusting there. What was your experience like training here, having immigrated?
Yeah, I mean, the people were super nice. It was a positive experience. The culture, yeah, there is a difference. I came from a city that never sleeps.
Mm.
We came to Iowa City in 2001.
We sleep a lot.
We covet our sleep.
Very sleepy.
And we take the garbage out in sweatpants.
Yes.
It's a very quiet place, not, Beirut is just like, I mean, you could decide to have dinner, at 11 p.m. and most of the restaurants will serve you dinner. Actually, we never go out to dinner before 10. So here we had to go out to dinner at 7 because the kitchen's closed at 8 or 9. I can't
7 sounds pretty late to me.
Yes.
I'll just say that.
tell you how many times we got kicked out of restaurants because we showed up late. So there was a little bit of adjustment in that sense. The weather itself was an adjustment. One of my biggest things was actually picking up on the cultural cues. People would be joking and referring to certain shows or certain people or certain icons or using football analogies. Football in Lebanon is soccer. There's only one football. So people would be using references to baseball or football in like their regular talk, and I'd be like, what is that? I don't understand the joke, or I don't understand the reference. And sad to say that even to this day there are still some references that I struggle with.
Oh, Katie gives some references in like baseball that I'm like, you're gonna have to. What is that? I don't know what you're talking about.
We're working on it though, Katie.
We
We're
are.
going to bring you along.
Yeah, Katie can bring you up to date on those sports references.
Good. So I know who to go to now.
Yeah, that's right.
It's definitely Katie. Yeah. Well, we were also, in the introduction, we mentioned that you got both your master's in clinical investigations. That was 2007 to 2010. And then also your master's in medical education, 2016 to 2019. We were kind of curious what particular skills or perspectives these degrees added to, your career to make, or how they were useful for your career moving forward, I guess.
Yeah, both were very useful. I've always known I wanted to teach. My mother was a teacher, and I loved what she did. I loved watching her prepare for her classes when we had no school, or usually we don't have no weather bad days, but we would have bombing and shelling, no school days. So on a day like this where she had no other place to put us, but yet she had to go to her school, she would take us with us. So I got to watch her a lot teaching, and I just loved seeing her go through this. And when I grew up a little bit, she would let me correct her students' assignments. Of course, she would correct after me, but she would give me a stab at them. So I've always known I wanted to teach. So going into medicine, I knew I wanted to teach medicine. I wanted to doctor, but I wanted to teach. And then you start watching your professors, and a lot of my professors, back when I was in medical school, were the traditional triple threat. Who did the teaching and research, and were good clinicians. This is before the crazy RVU days and what have you. So I grew up with that mindset, right? I'm going to be the triple threat. So I did research in residency. I did research as an endocrine fellow, and when I finished my fellowship, I realized I had the opportunity to bargain for a master's degree as part of my sign-on package. The Masters of Medical Education was not online yet. They had not created it yet. But because I was doing research, I decided, doing a master's in clinical investigation would be a good thing. I've used it a lot, actually. It's come in very handy. Because I don't have a ton of grants, I do my own statistics. And I've taught my learners to do their own statistics. Yeah, so it's really nice to be able to do, your regression analyses yourself. Because I can't hire a statistician most of the times. So it's come in very handy. And then when the Masters of Medical Education became a thing, I knew I was going to do that sooner or later. Was too busy initially, with young kids and what have you. So in 2016, I think, I decided to just jump in and do it. And funny in that the Masters in Clinical Investigation, I've used it for my educational research since then. So they've really both helped me with what I do in terms of scholarship. But of course, the Masters of Medical Education has given me much more in terms of curriculum design, teaching technique, educational leadership, etc.
Wonderful.
Yeah, this is not a math podcast, so you've already blown our minds with you can do your own regression analysis.
I know, I was
Like
gonna say, did you see my mouth hanging open?
yeah, we were both like, oh,
No, thank you.
okay. We're more out of our league than we thought we were.
Yeah, I know. We're even more scared now.
When you then were promoted to the Associate Dean of Student Affairs and Curriculum, the Executive Dean, Dr. Winokur, said about you, through your interactions with the faculty, staff, and students, it's clear that you have a passion for pushing the quality of our medical student curriculum while at the same time connecting intimately with the students. And anybody who's worked for you or with you has seen this in action. Like you are an tireless advocate for the students, always bringing up their perspective, always talking about, you know, what the impact is going to be on the students of whatever, you know, curriculum change, and really pushing students to learn while also mentoring and guiding them in a way that is very student centered. How do you think about that balance of your kind of the man and also a student advocate?
Yeah, I mean, you know, if I'm truly a student advocate, I'm not serving them by not pushing them, right? So pushing them toward quality is part of advocating for them. And even though I may sometimes be tough in drawing a line or setting, you know, a high standard or a certain tough expectation, I think as long as you're transparent and show people that you care about them, and as long as you model that, people will know that your toughness comes from a place of caring, you know, not just not that you're just being insensitive. And I hope that I demonstrate this to people around me in the sense that if a student has a problem and wants my advice, you know, I spend time with them, I listen, I really try to put myself out there for them. You know, my door is always open for anything they want to bring my way. I love to teach them, and I teach many hours, but I think my hidden agenda in teaching, you know, I love doing it, you know, it's really, there's a lot of satisfaction, but another part of it is to show them that when you care, you go the extra mile, and when you care, you really work hard to, I hope they see from my lectures that I've put a ton of work into it and a ton of effort into it, and it's not just, you know, a 5-minute job. It's a many hours result. You know, it's the result of many hours of work. Um, and and the message from that is, you know, if I didn't care about you, I wouldn't do this for you. But on the flip side, you're gonna pay me back my service by meeting my expectations and by raising yourself to the standard I'm setting to you. I mean, I use the same thing. I use the same thing with people around me, you know, with my friends, with faculty who I'm like a, you know, mentor for, and definitely my kids. You know, is that, you know how much I love you and you should never doubt this, but because I love you, I'm going to be that mother who is going to be, you're going to be scared of at times.
I love that. You just got really serious, and I loved it. I'm going to channel you at my house.
Yeah, I mean, really, my son, when he graduated from high school, he turned 18. When he turned 18, he told me, "Can you become my friend now?" Because I used to tell them, I always tell them, "I'm your mother, I'm not your friend." And he when he turned 18, he was like, "Can you be my friend now?" And I was like, "Yeah, I kind of like you enough. I like the person who raised you. They did a good job. I'll make you my friend now."
I love that. I was going to say too, like, your effort is so obvious. Like, I was just thinking about the emails. So after a lot of lectures, you'll have these like sticky points, right? And
Muddy points.
muddy points. I'm sorry, muddy points. And the explanations and the details that you give to students about the questions that they have asked, it blows my mind. Like, it's amazing. And I can tell, like, you say like, "Oh, I looked into this. Here are the sources, and here's this." It's just, you are definitely the role model there. So yes. So thanks for that. Well, in talking about connecting with students, and your firm support of their viewpoints and opinions, we were kind of wondering about, you know, how have you seen medical school curriculums and medical schools in general incorporate students' views more often? Because we see that from you. You know, we see you advocating on behalf of students and changing curriculum. You've seen that change over, you know, the time of your career?
Yeah, I think it has changed. I mean, if we compare to when we were medical students, where there was one package, and you just had to take it, right? And if you didn't like it, that's your problem. Um, it's changed a lot, and sometimes when I reflect on this, I think it's changed in both good ways and bad ways. Um, the good ways are in the sense that the students are, at the end of the day, the ones who are receiving this material we're giving them. And if they tell us we don't understand it, it means they don't understand it. It's on us to figure out how to make them understand it, and whatever that means, changing the style, changing the content, whatever it is. If they don't get it, they don't get it. I can't force it in. If they say, I don't see the value of this, now, I may disagree with them. If they don't see the value of this and I think there's value in it, then it's on me to demonstrate the value. But then they might be correct in that I'm giving them fluff or unimportant things, but then it's on me to honestly look at it and decide, does it all have to be there? So I think these are, all good ways of incorporating the student's opinion, because they're on the receiving end of it, and I either have to make them see what I'm trying to give them, or what I'm trying to give them is not important. In which case, how about I replace it with something that matters? On the flip side, sometimes, sometimes the tendency, because of accreditation guidelines, a little bit of the tendency has the pendulum has swung in the direction of satisfying the customer just for the sake of getting good reviews, and I disagree with that. And this is where that tough love comes in, is that you see my effort to help you and to advocate for you, but that doesn't mean that there's you don't have to do your part of the work, right?
Yeah,
And
absolutely.
we've got to be careful not to let it swing all the way the other end,
Yeah.
where it's actually at the surface looks like we're listening to the students and we're serving them, but in reality we're not really serving them.
Right.
And what a recent addition to your CV is you did the Hawk AI certificate program last year, which I did the first two of those, and it's really interesting to hear people who are actually expert, like content experts in that, talk about it
Mhm.
and learning about the background and et cetera. But it feels like we're really on the precipice of a revolution, obviously, with incorporating AI tools into medicine and medical education. And what's been your experience with trying to integrate that new technology into your various roles? Because as a clinician in patient care or as an educator, what are your thoughts or sort of ideas about that?
Yeah, as an educator, I'm trying to figure out ways to use it to simplify certain tasks, but more importantly, ways to teach the students how to be smart about using it. And it's one of those situations where you have to teach while you are still learning. So this is an evolving area, and we've added a few things. The idea of which is be smart users, and here are some tips on how to be smart about using it. I'm working with some colleagues to try from here, from Carver, and also from a different department, from a different college, to try to incorporate AI in how we teach clinical skills and clinical reasoning, and also incorporate AI into how we review qualitative data, because we do a lot of reviews on faculty, on courses, on clerkships, and it's pages and pages, of written comments by the students. And we're trying to figure out, if we could reliably create an algorithm that would save us time and effort and distill that information in a more timely way. We haven't fully figured it out yet because of all the hallucinations that AI is doing. But we're working on that. So these are some of the things I'm looking at into trying to incorporate AI into the workflow and into teaching.
I love that. I was at a conference and they were talking about AI and they said doctors are not going to be replaced with AI. Doctors who use AI are going to replace doctors who don't. And
Right.
I thought that was a really,
I
really
think so.
well said. And I was like, but it is hard to stay up to date. these things. It's changing so quickly. But
well, yeah, the thing that I heard at a meeting, same thing, was if AI can replace you as a teacher or as a clinician, then it should.
yeah,
You know,
that's a good point.
it
Yeah,
should,
Yeah,
yeah,
because you're very replaceable then by something that's
yeah.
automated and
By
not
computer.
personalized.
Yeah,
So
yeah.
such a good point. Well, AI is kind of a curveball, but one thing we like to ask, faculty and our women trailblazers is just, did you have any curveballs or really unexplained or unplanned opportunities that really led your career in an unexpected direction? One you already pointed out was you were planning to go to, PhD and ended up in MD. Any others that you can think of throughout your way that were really like, oh, wow, looking back, that was a really fun curveball that got thrown at you?
Yeah. Um, yeah, I mean the most proximal one, the most recent one, which is not super recent, but so in 2013, when we started the new curriculum at Carver, I applied to be a strand director, and I didn't get that position. And at the time, I was told one of the reasons is I'm a doer. I'm more of a doer than a leader, which made me really upset at the time, and kind of got me thinking about how can I show that I'm also a leader. Um, so I kind of sat on that, I mean, I was a course director. Um, and a couple of years later, internal medicine was recruiting for, there was a change in the associate program directors and some of the positions in internal medicine. And then I applied, and I didn't get that position, which again, for a minute now, I'm thinking, well, here's the second rejection I get in 2 years. Clearly, I'm not good enough. I'm not equipped well enough to do this, and I'm clearly not the leader that I think I can be. I haven't shown enough leadership. So then, shortly after that, I was basically called upon and offered to consider the position at the VA, the Associate Chief of Staff for Education, which was not something I ever thought about. And to be honest, was not in my career plans because it's a position that is purely administrative and does not have any hands-on, no touch points with learners, no direct touch points with learners, which is not me. And at the time, it felt like it was a compensation prize for not getting the associate program director position. So I was very tempted to just say no. And then I talked to a friend who's also a mentor in this space. And she recommended, she said, well, you're struggling. You're thinking you're not a leader. You're thinking that the message that these rejections gave you is that you're not a leader. Well, here's a pure administrative position. So the only thing you can do in that position is to be a leader. Why don't you take it? Well, A, it's a move up in your career. It's not exactly the move you were thinking, but why don't you take it? If nothing else, prove to yourself or learn leadership. So I took that position, and I took it for a couple of years, and there was a fair amount of leadership in it. And it wasn't on my agenda to become a dean. Like I had never thought about it. There wasn't any open position, so I had never considered that. And then this dean position here as an assistant dean opened up 2 years later, and I think it's that position at the VA and what I was able to prove, and a couple of things that I did for the College of Medicine, for the students at the VA that no one had been able to achieve before. They were kind of stuck, and I was able to move the needle there and to get the project done. Were my ticket to come back as an assistant dean. So that was a little bit of a curveball in the sense that I lost two positions I wanted. I was offered a position I didn't want. A mentor told me, go ahead and take it. And then that brought me back where I wanted to be.
Love that.
And that's like an amazing story, because I think one of the themes that has been coming up as we've been talking to all these women is that I think, especially if as a learner, like when you're early in your career as a resident or a student, you have this idea that your career is going to be very linear, and that it's just like, I'm going to go to residency and I'm going to do this and then this and this, and it just is going to follow. And I think it's easy if you have that mindset that you reach a stumbling block where you don't get a job you think you should have gotten, where that could be very disruptive to your development of your career, because you might, like you said, you might decide that really maybe I can't do this. Like maybe I don't have the skills. But I think it's important for people to hear these stories of like times where you end up saying yes to something that you wouldn't have expected, or not getting what you thought you wanted, but it still puts you in a path to get to where you belong.
Right.
And I think that's a great story. Really helpful.
Yeah, absolutely. Yeah. And I'm happy. I'm happy I took that opportunity, and it was a challenge, and I had to learn a whole new system. But I think that was a big milestone in my development and developing certain skills and learning how to deal with different systems and different types of people, but also improving outwardly proving what I can achieve.
Mm-hmm.
Which I
Starting and then completing a project at the VA is
Oh yeah.
like, that should actually be like at the top of everybody's list if they're hiring. It's like, oh, you got something done at the VA, like it actually like happened the way you wanted it to. That is a lot of work and stick to itiveness for sure. I'm like actually still reeling from the insanity of saying to somebody that they're a doer and not a leader. Like, what do we want our leaders to be, right? Do we want them to just say things and have other people take care of them, or do we want them to be people who have started and finished projects and have said what they like, done what they said they were going to do? I mean, I'm enraged. And I had a lot of caffeine this morning.
I've gotten over that one. I'm still a doer.
Well, I just heard the
You know
story, so
me,
I'm
so you
still
know
mad
I'm a
about it.
doer, right?
But I think that is just a wild justification for not giving somebody an opportunity.
Yeah.
It's almost like, oh, you're overqualified.
Yeah. I mean, I don't know. I mean, it is what it is. It's in the past. But I personally think, and I stand with this 100, behind this 100% of the time, is to be a leader, you've got to be a doer. You've got to be able to roll up your sleeves and get in the mud. And if nothing else, is to show people how to do it,
right?
Or how you want it done.
This makes me reflect, because my mom had this saying. She would always say, I'm a worker bee, not a queen bee. Like, meaning like, I'll do the stuff, but I don't want to be in charge of stuff. But it's like, those are the bees we need to lead the other bees, the ones that do stuff, you know?
You can be both.
And
you can inspire the people who work for you to actually do their best when you show them that you're willing to do it with them.
Yeah, I think you can be, like when I do stuff at my kids' school, I prefer to be a worker bee. Like, I'm like, give me a task, give me something to do, and I will clean the bathrooms. I'll do whatever. I just want somebody to tell me what to do. But I think you can't be the queen bee without having worker bee abilities, right? I think you can. I think you have like the truly like effective queen bees have been the worker bee and brought those skills forward and are able to lead by example that way. Because I think it's really hard to just sit and tell other people what they should do and how they should do it if you're not willing to show that you can or will do it.
Yeah, absolutely.
Right now at this moment in history, I think where we have sort of giving vaccinations is being criminalized at the level of the Iowa legislature. So I think advocacy is going to be an increasingly important part of our profession. Like, we need to justify what we're doing and why it's important a lot more than maybe we did in previous decades. You're very active online in terms of your advocacy for things you believe in. What recommendations do you have for physicians, faculty, and students who are interested in being an advocate? Because it's risky at times, and you definitely put yourself out there. What would you advise people in thinking about how do they want to get out there as an advocate?
So let me start, and this is not something I invented. This is something that I read in a book by David Brooks. And I think he did not invent, he was quoting someone in the book, to care more, at least this is where I stand, I care more about what's going to be on my obituary than about what's going to be on my CV. And I see this every day. I'm an osteoporosis doctor. So, I joke by saying the average age of my patients, the average clinic age for me is right around 80. Uh, so I have a lot of older and old people, and many of them were very accomplished people in their lifetime. They're professors. They were, you know, big shot, engineers, administrators, you name it, researchers, etc. You live in a town like this, and you take care of older people. Guess who a lot of the older people are going to be, right? But when I see them in my clinic, it doesn't matter anymore what research they did or what paper they published or what patent they got, right? In that moment, they're an older person. They're worried about their mobility. They're worried about their day to day. They're worried about their family. They're to some degree looking at how they're gonna enjoy the upcoming summer, or what legacy they're leaving, right, for their family more than anything else. And that actually gives me a lot of reflection about how do I, like, when I am in that seat, when I'm the 80-year-old, what am I going to be looking at more, at my CV or at my value as a human being and what I did around me? So my advice to people is always think about that. It centers you, it puts everything else in context. And in terms of advocacy, is you need to understand your moral compass and understand where you stand on those issues. And it takes courage to advocate. But if it wasn't tough and it didn't need courage and it wasn't scary, it wouldn't have needed advocacy, right? So you need to understand where you are, and to make the decision of, is that moral compass and that value I believe in more important or less important than the next grant or the next job application or the next promotion? Because it doesn't mean that every time you advocate you're losing that stuff, but in certain situations you might be risking them. And then decide what level of advocacy, where's the safe zone for you. And it could be as simple as educating someone in your office, which is low risk, right? Or it could be as drastic as going on strikes and protests, which is much higher risk. And there's no real expectation. Anything you do, it's really bearing witness and being there and doing something, and that's something you get to decide what it is. But be true to who you are.
Love it. Love it.
Ready.
All right. Prepare yourself, Amal. This is where it gets spicy. I'm just kidding.
Uh-oh.
All right. First one. So we'll just ask a few of these more rapid questions. All right. If you could go back and meet yourself on your first day of internship, what would you tell yourself?
It's all worth it. Do it again.
Oh, love it. Okay.
Frequently, it's like, it's going to be okay. Like, there's a lot of like reassuring ones here, but I like that it's like, yeah, it's scary, but it's going to be worth it. Like, I kind of like that attitude.
Yeah, I like it too.
What's one thing in medicine that grosses you out? Do you have a gross out?
Yeah. When you're rounding and the patient just had a bowel movement and that thingy that sits next to the bed and the room smells. And you still have to pretend like you can't smell it, and to laugh and to breathe and to smile.
Yeah. Hey, that was one benefit of always masking up, right? Like
that was the one thing that, like, I was thankful for every time I stepped into that room with a mask on my face.
Yep. Love it. We love to ask women doctors about menopause, and we're so excited that we have an endocrinologist with us. Any thoughts, ideas, recommendations you'd like to share on menopause?
On menopause. What patients say about it's hard to lose weight after menopause? That is true. I used to think they're making it up.
Okay.
I used to think just eat less.
Because that's so easy to do.
There's only so little you can eat, unfortunately.
This is actually real stuff.
Yeah. Okay.
Yeah. And unfortunately, a lot of your patients, the weight they're losing is bone density.
Yeah.
That too.
That's not great. We don't want to lose bone mass.
Yeah. Those femurs strong.
Those femurs heavy.
Yeah, heavy femurs. Yeah.
Any embarrassing situation that you could think of that you can laugh about now? Like Katie dropped her pager in the toilet in the past, yesterday.
Embarrassing at work. Yeah, talking about dropping pagers, it wasn't my pager, it was my phone. And I was in one of those, multiple user bathrooms. And the person in the stall next to me heard the sound
Oh,
and said, ouch.
Hey, I mean, some people talk between those stalls, you know. Like,
Right,
I've
yeah,
always-
but so then I had to come out, then I knew when I stepped out of that bathroom, with my phone in my hand,
Yeah.
she knows where it came from.
Absolutely. She knows
You're busted.
exactly.
She knows exactly where it came from.
But hopefully she was appropriately empathetic.
Yeah.
Right?
She actually was really helpful. I came out and I had it wrapped in Kleenex and whatever. She told me I need to get it into rice,
Oh,
but
yeah.
it was at work, so I couldn't get my hands on rice. And I was like, I'm just going to take chances. I washed it. I was like, if it survives this, then it does. Otherwise, it's time for a new phone.
Yeah, that's
And
right.
it actually did survive.
Wow, it survived the toilet and the washing.
Without rice.
That's impressive. Okay. Favorite hospital cafeteria item? This could be a food or a beverage.
Cinnamon rolls.
Oh,
Ooh.
good choice.
Yeah.
Here at the university
Yep.
cafeteria?
Yep, that's the only thing I would eat from that cafeteria.
It's true.
That's a good tip. Not the sushi then. Okay. Noted.
But I mean, the sushi is okay, I guess. Yeah, the sushi is if I'm really, really hungry. But no, the cinnamon roll, I crave that every so often, so I go get it from there.
Wow. Okay.
Theirs is a little bit drier, and I kind of like that texture.
And okay, our historical woman in medicine is today Dr. Rebecca Lee Crumpler, and she is the first Black woman in the United States to earn her medical degree. She was born in Delaware in 1831, and she was actually drawn to medicine because she lived with an aunt who was kind of known as the neighborhood caretaker for everybody. So her aunt would always go to the neighbors, help them out. And in the 1850s, she moved to Massachusetts to become a nurse. But then she ended up staying and going to the New England Female Medical College, or NEFMC, which doesn't quite roll off my tongue, but I'm going to keep working on it. And this is kind of fascinating. So this school was first set up to train women as midwives. So there's a gentleman named Samuel Gregory who believed that male physicians should not be present during childbirth. So he started this school for women to become midwives. But then by the 1860s, they offered more classes. And in 1864, Dr. Rebecca Lee Crumpler graduated with her Doctorate of Medicine degree. And then she started her practice in Boston. But at the end of the Civil War, she went south to Virginia to care for formerly enslaved African Americans. And she was a true trailblazer. She talked about how she really felt called to serving this population. And she said things similar to what you said, Amal, it's not, this is my job. Like, it should be hard. And there are times where it's going to be hard. And she fought against prejudice, both against women and against African Americans. She published a book entitled A Book of Medical Discourses in 1885. And I just wanted to honor her today. And also, I actually quizzed Katie on this, and she got this exactly correct. So I had no idea. So according to the Association of Black Women Physicians, the percentage of Black women physicians in the United States right now is 2%. And, our goal here is to lift up all physicians, all women physicians. And just wanted to say a big thanks to all the Black women physicians out there, because they're trailblazers. So that was our Women in History today in medicine. So, yeah.
Thanks, Katie.
Yeah, thank you. Any questions about that? Anything? Katie sometimes pimps me on things. So she does these deep dives because she's the journalist of us. And
I have to say, you both are outstanding journalists.
We're working on it.
So if you're ever looking for a second career, a backup career, you're all set.
Well, when this podcast takes off, it's going to cut into our practice for sure.
Worldwide.
Viral.
That's what we're planning. Yeah. No, thank you again.
Thank you.
Yes, thank you. Have a good day.
Thank you so much.